Behavior Analysis Certification Board, BCBA Level Exam Prep. Content Area 1, Terms and Definitions. Approval of programs. For restrictive programs, informed consent should be obtained where appropriate. Informed consent may be circumvented if the client is in serious danger, if the treatment has a reasonable chance of success, and if there are procedural safeguards in place. Approval should also be obtained by a BCBA or LRC chair as stated in 65G. Bill of Rights of the Developmentally Disabled and Other Rights. Developmentally disabled individuals should be afforded basic rights, including the right to medical care, privacy, central file, habilitation plan, personal belongings, due process, freedom from unnecessary restraints or cruel and unusual punishment. Components and limitations of emergency procedures. A. Should be accompanied by active programming strategies. B. Use only when absolutely necessary. C. Behaviors and precursors should be clearly defined. C. Train staff how to implement. Consider logistical problems. E. Ensure adequate staff. F. Ensure reporting, monitoring, and evaluation. G. Avoid or minimize negative side effects. Avoid dangerous confrontations when possible. Confidentiality. Attempt to keep clients' personal information away from public view, to be released only with consent of the client or guardian. Counting period floor, which used to be called record floor. Number of minutes spent observing. Echoic, controlling variables. Verbal stimulus determines form plus audience, the SD, plus GCR. PTP and similar forms. Emergency procedures. Procedures designed to protect the person, others, or the environment from the immediate harm, not as therapeutic interventions. Two types: immediate restraint and immediate isolation. Emergency situations. Situations that present a risk to the client or others. Three types. 1. Behavior that is totally unexpected. 2. Behavior that is low frequency. Example, less than 6 per year. 3. Behavior that must be managed until a program is in place. Example of verbal behavior under multiple control. Example, impure tact. Kid who tacks, quote-unquote, paper that is evoked by specific EO. HRSM 160-4, Behavior Management Guidelines maintained by the Developmental Services of HRS, specifies the range of aversive procedures that can be used and the approval requirements thereof. If data points are going down on a standard chart and the data are duration data, what is the trend? Upward trend. If data points are going down on a standard chart and data are rate data, what is the trend? Downward trend. If data points are going up on a standard chart and data are duration data, what is the trend? Downward trend. Intraverbal, controlling variables. Verbal stimulus determines form, plus audience, SD, plus GCR. No PTP correspondence of stimulus and response. Least restrictive treatment. Using treatment that minimizes suspension of basic rights or freedoms. The least restrictive treatment that has a reasonable change of success should be used. MAND, controlling variables. EO determines form, plus audience, SD, plus specific reinforcer. Meaning of a word. Variables responsible for its emission. Normalization. Living environments and treatment procedures should be used that are most like those applied to normal populations. Procedure selection. 5 issues. A behavioral programmer should consider the following issues in selecting a procedure. Use the least restrictive procedure. Use the most normal procedure. Are staff trained to implement procedure? Is there a competent behavior analyst to supervise? And is there support for the procedure by significant others? Program review process. LRC, Local Review Committee, approves restrictive behavior programs in its DCF district. PRC, Peer Review Committee, comprises experts in the field, provides technical assistance. HRAC, Human Rights Advocacy Committee, attempts to ensure that basic client rights are protected. Right-hand axis on standard chart. Time. Tact, controlling variables. Nonverbal stimulus determines form, plus audience, SD, plus GCR. Textual, controlling variables. Verbal stimulus determines form, plus audience, SD, plus GCR. PTP correspondence, but dissimilar forms. Verbal behavior. Behavior that is reinforced with the mediation of another person. X-axis on a standard chart. Days. Y-axis on a standard chart. Count per minute.